Hello, and thank you for joining us for TGH Ask an Expert, a live Q&A series. I am your moderator, Karen Loftus, joined by Dr. Courtney Mascoe, a pediatric and adolescent gynecologic and minimally invasive gynecologic surgeon, and Diana Encalada-Soto, a fellowship-trained minimally invasive gynecologic surgeon. Thank you both so much for being here today.
Thank you for having me.
March is Endometriosis Awareness Month, and that is why we are here today. We do have a few housekeeping notes. If you have any questions as we go along, place them in the comments section. We will get to as many of those as we can as time allows. Plus, we have many pre-submitted questions. And a reminder, yes, Dr. Mascoe and Dr. Encalada-Soto are medical experts, but please always consult your primary care provider for individualized medical advice. Let's get started by making sure everyone knows what we are talking about today. Dr. Encalada-Soto, what is endometriosis?
Endometriosis is a chronic inflammatory condition where a tissue that is similar to what is inside the lining of the uterus grows outside of the uterus. The most common places are the ovaries, the peritoneum, which is kind of a surround wrap that covers the pelvis, as well as some ligaments of support of the uterus. But it can grow in other organs as well, like in the bowel, the bladder, and distant other spaces. So as so many of my patients say and have understood with time, is that it's a full body disease.
And it's a condition that we used to think didn't affect our younger patients. Historically, this was not something that we investigated in girls and young women, but we are seeing patients as young as 11 and 10 who are being diagnosed with endometriosis.
Okay, thank you both for laying the background there for this discussion. Let's get to some of our pre-submitted questions. We'll start with a question from April. April wants to know, what are the symptoms of endometriosis? Dr. Encalada-Soto?
Symptoms, but the most common things that people present are what we call pelvic pain, usually related to the cycle or to menses, as well as dyspareunia, which is painful sexual intercourse. There's also a lot of patients that present with pain with bowel movements, and it's usually related to the cycle as well. But there's other women that present as well infertility or difficulty getting pregnant, and endometriosis can be one of the culprits. So it has a very wide presentation. Another classic one is the sensation of bloating. Of a lot of patients also mention this endobelly sensation.
Okay, we have another question from Terry. Terry wants to know, at what age can you look for symptoms to start, Dr. Mascoe?
We can start to look for symptoms as soon as patients start to have periods. And the youngest age that I would say is normal for having a period would be age 9. So anytime a patient has periods that are disruptive, painful, and require for them to miss work, school, or their extracurricular activities, this should warrant a visit to their gynecologist for further evaluation. And my practice is to trial medicine to manage these symptoms for at least 6 months to a year before moving to surgery to evaluate for evidence of endometriosis.
Okay, that's very good to know. We have another question that was pre-submitted from Chernell. Chernell wants to know, why is endometriosis so difficult to diagnose, Dr. Encalada-Soto?
There's several points to answer that question. I think first one is that it can present in different ways. And so, for example, people that have very severe disease, they may have little symptoms. And people that have more peritoneal or superficial disease can have very debilitating pain and symptoms. So there's not one way where it can present. Also, that it has a lot of other conditions that overlap symptoms with it. Since I always say, endometriosis is in the pelvis, and there's in the vicinity a lot of organs. So not only the uterus, not only the ovaries, but there's the bowel, the bladder. So there are conditions like IBS or inflammatory bowel disease or inflammatory bowel syndrome, interstitial cystitis, which can share some of the symptoms. So that makes it hard. But also some of our best imaging modalities even vary a lot in the way that they can diagnose the disease. For example, deep disease that is very visible on imaging or endometriosis in the ovaries can be seen in ultrasound or an MRI, but the more superficial or peritoneal presentations may not be seen on these imaging studies. And to this point, we don't really have an excellent or proven way to diagnose endometriosis 100% sensitive or specific without a surgery.
Okay, that conveniently leads us into our next question. We have a question from Heather, and this is about surgery. Heather said, if you have had surgery for endometriosis, how long before it needs to be done again? Dr. Mascoe.
So there is no official timeline that I would tell patient that surgery needs to be done again within. Our hope is to reduce symptoms and make patients comfortable with as little surgical intervention as possible, because we know that surgery is not a health neutral event and it comes with its own risks. But we do see that there are many patients with endometriosis that need more than one surgery. And we estimate that by like 5 years after surgery, about 20% of patients need another surgery. My practice is to try and optimize medical treatment for at least a year following surgery before proceeding to another surgery.
Okay, that makes a lot of sense. And just a reminder, if you're tuning in live and you have a question that hasn't been answered already or something that you'd like to ask the doctors, please leave it in the comments of the YouTube or Facebook platform, whichever you're tuning in from. We're going to continue with some of the pre-submitted questions. We have one from Rebecca. Rebecca asks, does having endometriosis increase your cancer risk? Dr. Encalada-Soto.
Excellent question. I think we have to kind of really answer, not really. Like, I don't think we have to focus too much in the increased risk of cancer. Now, there are associations. For example, for specific types of endometriosis, when there is endometriosis in the ovaries, what we call endometriomas, those cysts do increase very slightly the risk of ovarian cancer, specifically some types like endometrioid or clear cell ovarian cancer. But there are certain features that we would look for to increase that risk, as well as in certain situations when there's deep endometriosis in the bowel, accompanied with adenomyosis, another condition that can exist. That increases slightly that risk for bowel cancer, but overall, the risk is very low. So I would say the main focus is in quality of life or improvement of symptoms more than that risk of cancer.
Okay, thank you for explaining that. We have another question from April, who pre-submitted one and wants to know, does endometriosis cause fibroids? Dr. Mascoe?
Another really good question. Endometriosis does not cause fibroids. These are two distinct conditions, but it is possible for a patient to have both endometriosis and fibroids at the same time. Fibroids are very common in reproductive age women. We think that about 70% of reproductive age women have fibroids. So it's not surprising that some of the data quote numbers as high as 25% of women with endo also having fibroids.
Okay, thank you. We have a question from Jasmine. Jasmine wants to know, what's the likelihood for pregnancy after excision surgery, and how do adhesions complicate that timeline and potential pregnancy? Dr. Encalada-Soto?
It's another question that I think it has different answers. So depending on the type of presentation of endometriosis, I would say moderate to severe disease definitely can have a very negative impact on fertility, because endometriosis is a condition that can cause scar tissue and can cause deformation of the anatomy. So one of the ways that surgery can help will be restoring that anatomy to allow for pregnancy to occur. But fertility, it's complex in itself. So usually we want to also discuss and work with our providers of reproductive endocrinology and infertility specialists, since fertility can also have some other reasons to occur, like age of the patient, ovarian reserve count. So all those things can come into play. But if it's related to endometriosis, after an excision surgery, the data is that there's a 30 to 50% chance of improvement of fertility outcomes. So that's pretty good. But we always try to recommend to go ahead and pursue fertility in the year after or in the next few years after the excision, because absolutely endometriosis 1 can recur, unfortunately, and in itself can cause a scar tissue and damage after some time.
Thank you so much. Dr. Mascoe, I have a question here in the Facebook comments from Ophelia. And Ophelia was wondering, what can be some of the causes for children as young as 11 to get endometriosis?
Yeah, that's a really good question, and not one that has a great answer yet. We have a lot of different theories as to why people get endometriosis, and I think that seeing it in younger ages speaks to kind of the main three that we see. I see sometimes in girls who have differences in how their uterus and vagina are develop while they're still inside of the womb, and don't have a way for the period to come out, have a higher risk of developing endometriosis. One of the theories is retrograde menstruation, or the period coming out of the fallopian tubes if there's a blockage. And so that's something that I can see in the younger girls, not infrequently, who have the endometriosis. But sometimes even without these structural differences, we still find endometriosis, which could speak to a genetic predisposition or these cells just changing while the patient's developing in the mother's womb and increasing her risk for endometriosis.
Okay, thank you for fielding that live question. We have another question from the comments, and I'm not sure which doctor this is directed to, but Lauren asks, when you say optimize medical treatment, what does that typically entail in your practice?
I think that was in response to something that I had said. And what I mean is kind of a multimodal approach to managing the pain associated with endometriosis. And so that could include medical management with pills that can help prevent us from having periods. It could mean pain management, working with our colleagues in pain medicine. Also can entail us utilizing our colleagues in pelvic floor physical therapy and really trying to attack the pain and discomfort from several different angles to try to improve patient comfort before returning back to surgery.
Okay, thank you for explaining that further for our viewer. We have another pre-submitted question from Lauren about diagnosis. Are there non-invasive ways to diagnose endometriosis, something other than surgery, Dr. Mascoe?
So like Dr. Encalada-Soto mentioned earlier, histopathological or tissue diagnosis remains the gold standard for diagnosing endometriosis, and this does still require surgery. In recent years, we have come to realize that this need for tissue diagnosis, the gold standard, leads to a delay in diagnosis for many patients, with many patients taking as long as 10 years to get their diagnosis of endometriosis. So to try to expedite evaluation and diagnosis, there are various modalities of clinical diagnosis that are being investigated, like improved imaging with MRI, with specific protocols such as what we utilize in our Center of Excellence, as well as laboratory testing. But these are still under investigation, and none have replaced a tissue diagnosis as the gold standard as of yet.
Okay. We have a question that came in from the YouTube platform for Dr. Encalada-Soto. If someone were to get a hysterectomy due to endometriosis, should there be a repeat ultrasound to check to see if the disease has reoccurred?
That's an excellent question. I think the first thing is, who does the surgery? If it's an excision expert, there should not be a need to necessarily monitor for disease changes unless there are symptoms that occur after a hysterectomy that would lead to believe there's a change in the clinical status of the patient. But of course, there are many patients that are told that a hysterectomy will cure endometriosis, which is definitely one of the biggest myths in endometriosis care.
Okay, thank you. And finally, just a reminder, if you have any other questions that you want to put in the chat, we've got a few more minutes to answer them and we have some time. So feel free to add them if you get an opportunity. But right now, Dr. Encalada-Soto, your team is conducting a research study. Can you share a little bit about that as we bring up the flyer for our viewers to scan the QR code to take a survey?
My pleasure. We are conducting a research study that will gain access to understand a little bit more about the barriers that patients experience accessing care for endometriosis. As Courtney mentioned, there's a delay in care of up to 10 years. So we want to try to understand what would be the best way to address this and what can we do as Center of Excellence or TGH to improve that access for patients. It is one that is in Spanish and English, as well as it's open for in not only the US, but other countries as well, so everybody can access it, and it takes only 5 minutes. You have here the QR code, but we're also going to share our link in one of the comments as well.
Okay, and I just saw that link go up, so thank you to our phenomenal marketing team and Taylor for dropping that in the comments for everyone. And also thank you, Dr. Mascoe and Dr. Encalada-Soto, so much for your insight and your answers today. Lots of important information that you both got out there for our viewers. If you want to know more about endometriosis and TGH's minimally invasive gynecological surgical procedures, please visit the web address on your screen or scan the QR code to take you right there. Thank you to all who joined and submitted your fantastic questions. We look forward to having you again on the next installment of Ask an Expert, which is just 6 days away. Tuesday, March 25th, we are talking women's heart health and an underdiagnosed condition called SCAD. Have a great rest of your day.